When are injections the right option for treatment? So there are different types of injections that you can have. Most commonly, we talk with patients about steroid, commonly called cortisone, or PRP, called platelet-rich plasma. These can be used to treat and help with pain related to multiple different injuries that you can occur. So cartilage problems with arthritis, tendon problems with tendinitis or tendinopathy, even some muscle and ligament injuries can be managed with injections. Typically, we move to injections when other less invasive treatment options are not working. So things like over-the-counter medications, ice, heat, physical therapy exercises, if those have not been helping your pain, then we move on to the injection options. Which injection is better, the steroid or cortisone or the PRP or platelet-rich plasma? And they're both very different things. Steroid or cortisone injections are really strong anti-inflammatory that will decrease the inflammation at the site that we're treating pretty rapidly. So it works very quickly. It's pretty reliable that it's going to decrease the inflammation at that site of pain. However, we do now know and are learning more and more that steroid injections can be toxic to cartilage cells. So in arthritis, they can actually worsen arthritis if performed over and over again. And they're also toxic to tendon cells. So if we put the steroid near a tendon, it can increase the risk of rupture of that tendon subsequently. So it's not without any risk. Platelet-rich plasma injections, on the other hand, don't have those same risks, where we don't think they're toxic to cartilage cells or toxic to tendon cells, but they're not a quick fix. So the steroid works really fast. The platelet-rich plasma injections usually take several weeks, even up to months, until you see the full effect. And both of these injections are usually combined with a therapy program. The other downside of the platelet-rich plasma injections is that they're not covered by insurance, so it's typically an out-of-pocket cost to have that injection performed. Most of the time, if we're doing platelet-rich plasma injections, especially if you're doing it into a tendon, we all like to use an ultrasound machine to guide the needle to make sure it's in the exact spot. Both of these injections are something that you should discuss with your healthcare provider so you know the pros and cons specific to you and your specific injury.